Welcome back to Coffee Talk with Mike and Janell. Today we wanted to touch base about common side effects of medications that we use with our ID and DD population. A commonly seen side effect is akathisia, and it's kind of a hard thing to explain, so I'm going to have Dr. Cummings delve right in and give us a little bit more information on what akathisia really is.
Thank you, Janelle. So akathisia is a very common side effect, but one that's not known to a lot of people and not discussed very often either, particularly in the IDDD ASD population. So it's a movement disorder that is typically described as the inner sense of feeling like you have to move to relieve discomfort. Um, Verbal individuals will say they feel like their skin itches from the inside or their muscles are restless. And the way that they can relieve that is by getting up, pacing, fidgeting, moving around. So, as you can imagine, it can be very distracting for the individual and for those around them, but it's also just very uncomfortable and difficult to deal with when you're experiencing it. So, it's one of the major side effects that we look for in the patients that we treat.
So, what kind of medications cause these specific inner sense of restlessness, feelings, those type of things?
Most commonly are the antipsychotics. These are, people know these names, but just so we're all clear that we're talking about the same things, the newer ones, Latuda, Risperdal, Zyprexa, Seroquel. There's others. Some of the older ones that we still use, Haldol, Prolixin, Thorazine. Those are the most common causes of akathisia. But there's other medications that people may not realize. The antidepressants, especially the SSRIs, so the Prozacs, Paxil, Zolofts, Lexapros, can cause it, and even things that we give individuals for nausea. A lot of the autism population will have GI problems, maybe prescribe something like Compazine or Zofran, Reglan. Those can all cause this inner sense of restlessness that can be quite debilitating.
Yes, yes. And so it's interesting to me because initially when I used to see patients, who maybe were diagnosed with schizophrenia, something like that, and, you see them on the psychiatric unit and they're pacing and they're kind of mumbling and they're going back and forth. I just assumed maybe they were paranoid or they're irritable or something like that. But they were probably experiencing akathisia, yeah?
Absolutely. I
Okay.
mean, there's obviously a lot of reasons that can cause the things that you see, but akathisia is probably right up at the top. And again, if you're not looking for it, you're not going to find it. If you don't find it, you're not going to be able to treat it.
Right, right. So what is the treatment for akathisia?
Well, most commonly, what we would ideally do is either reduce or stop the offending agent. So if there's a medication that we think is causing it, if we can lower the dose, if we can replace it with something else that may be less common. The thing is, we prescribe a lot of these medications for very important reasons.
Mm-hmm.
So the option of removing the medication just may not be there.
Right.
In that case, we add one of two different classes of meds. So one is the benzodiazepines. People will be familiar with the most common ones, Klonopin, Ativan. The other are beta blockers, medicines that people may not actually know about as much. The one that we use at APEC the most is something called propranolol. These are typically used for high blood pressure, sometimes for social anxiety, for migraine prophylaxis. In either one of these two medication classes, it can be nice because you're killing two birds with one stone. They both can work toward anxiety, for instance, and treat symptoms like that. Sometimes aggression and other symptoms that we're trying to target, while also reducing akathisia. The issue with the benzodiazepines is that they're controlled substances.
Right.
You can become tolerant or addicted to them, and a lot of primary care providers, especially, are hesitant to prescribe them. So our go-to medication typically will be propranolol to reduce akathisia. It very rarely has side effects and can be incredibly helpful.
And it seems kind of like an oxymoron to prescribe a medication to prevent side effects, but propranolol actually has minimal side effects. So
Absolutely.
it's a very good go-to drug. Another thing I just wanted to, ponder with you a little bit is obviously akathisia is super uncomfortable for any person who's experiencing it, but why is it so important with our IDDD folks to identify this and treat this?
Absolutely. So yeah, I mean, as you said, across the entire neurodiversity spectrum, akathisia can be uncomfortable. It should be talked about if you're prescribing these medications. It should be looked for by prescribers. But if you're an individual who is not verbal or uses very few
Hmm.
words, you're gonna have a really difficult time describing this. Think about this very complex inner sense of
Right.
restlessness thing to your loved ones, to your care providers, and discomfort leads to agitation, anxiety, self interest behaviors, aggression. In the autism population, very commonly people with autism can have what we call stereotypies, so repetitive movements that they do over and over again, or stimming,
Right.
where you may see a child flap or do something else that they do to kind of modulate all the sensory input that's coming into them maybe too quickly. And because of that, a lot of prescribers will think that the restlessness and the fidgeting that we are seeing is just part and parcel to the autism and not a medication side effect that is treatable.
Or think ADHD, they're fidgety, they can't
Absolutely.
sit still. What's going on here? Or even OCD when they're doing the repetitive things. So it's super important to, you know, clarify diagnoses. And it's really unfortunate, but a lot of our folks, can't speak or can't articulate or describe what they're feeling. So you made a really good point there, and I'm just glad. So this is something we should all be looking for, and we wanted to bring to your attention. And we will probably be discussing more side effects next week.
Absolutely. And as always, if you have specific questions about your treatment, speak to your primary care doctor or psychiatric provider. You can always reach out to the APEC team with general questions, and we'll do our best to get the right information out to you and the people who are taking care of the people we treat.
Yes. Until next time, APEC out.